Hi there. So 2026, we just can't believe it, but we're getting started again. And I've just produced information about embryo disposition, and that means for couples who produce embryos, if one of them was to pass away, can the other one still use the embryos, and how does that work? And if you haven't watched that, it's probably worth watching. But this is specifically aimed at women who are looking to preserve their fertility. And the question I'm often asked is, should I be putting away eggs or should I be putting away embryos? Now, for the single women that aren't in a committed relationship, well, then the answer is most definitely you need to put away the eggs because this preserves your fertility and your fertility choices going forwards.
Single women preserving eggs.
The most tricky group, though, are the women that are in a committed relationship, whether they're married or whether they're in a long-term relationship, and they have a partner, and they're asking, now, should I put away eggs or should I put away embryos? And one needs to be aware of the intricacies of this. If you put away eggs, you will only know the quality of those eggs when you go and use them in the future. So let's say you put away, as an example, 10 eggs at the age of 30, and you decided to use them at the age of 40. When we go and fertilize those eggs and test the embryos genetically, if they were all abnormal, you're left with zero. So you would only know that then at the age that you fertilize them, and at that age you may not be able to replace them that easily. So embryos offer you some certainty because you're basically preserving the final product. And that product can be tested genetically. So you can know I've got 2 or 3 genetically normal, which is called euploid embryos, and you would know if they're male or female, which is quite a nice position to be in. However, this comes at a cost. The embryos represent the stored fertility future of the couple, not of the individual. So if you're in a committed relationship and your husband or partner leaves you, or vice versa, your wife or partner leaves you, you cannot use those embryos without their permission. And so far, I have not yet seen a couple who has separated in which they've granted each other use of those embryos. So if you're in a committed relationship and you are freezing embryos, just be aware of the fact that those embryos cease to be yours when your partnership ceases. So if you're uncertain about what the future holds, it might be prudent to put away eggs and embryos in that case. I hope this probably has caused as much confusion as it has, enlightenment. But I say this really out of a point of concern. I've seen a lot of ladies in their late 30s, early 40s who have been left with embryos which they cannot use because their relationship has dissolved, and they're now not in a position to be able to replace the embryos, and they're looking at donor eggs. And I just want to prevent the situation from being your future. So when you're thinking about what to preserve, just remember eggs preserves the fertility of an individual. The same with sperm. It basically preserves the individual's future fertility choices. Once you go and put eggs and embryos or eggs and sperm together and make embryos, you're preserving the fertility of a couple. And if that couple ceases to exist and neither of you give each other the permission to use those embryos in the future, then they amount to nothing. So I hope this clarifies a couple of things. If you have any questions, obviously reach out and we're happy to answer your questions. Thanks so much.